welcome back to the clinic. What are you here for today?
I think I'm going to get my lungs and my heart checked out today.
Okay, have you been having any problems?
No.
Have you been having any shortness of breath, chest pain, dizziness, syncopal episodes, sweating, anything like that?
No, I just thought it would be a good idea to, check them out.
Any coughing?
No.
Okay. Any nasal congestion or anything that would make you think that you're sick? Has anyone in your family been sick?
No.
Do you have any medical problems?
No, not at all.
Okay, so let's get started. So I'm just going to kind of examine you by inspecting everything to make sure that you're properly aligned and your chest looks great, your trachea looks great, everything's in line. Just keep on looking straight forward. I'm just looking back here at your spine where C1, C7, and T1 are. Perfect. Okay, so now I'm just going to kind of feel a little bit. So I'm going to feel to make sure that you don't have any crepitus, like if your lungs were to release some air, some bad places, like here, which I do not feel, which is great. And now I'm going to feel your trachea to make sure that it's midline. Perfect. Okay, so now I'm going to go to your back. I'm just basically feeling to make sure that everything is symmetrical. So I'm going to need you to sit straight here. Perfect. You haven't been having any problems?
Not at all.
Okay. All right. And now I'm going to come back to the front. So I'm just going to percuss some different things to hear for where the air is, dullness, and stuff like that. So you're going to feel a little bit of pressure. If you feel any pain, just let me know, okay? So we're going to start at the back and work towards the front. Okay. I am going to have to make a little mark and do some measurements.
That'd be fine.
All right. Actually, let's undrape you here. Perfect. So I'm just going to mark this area right here. Same thing on the other side. Everything sounds great so far. Perfect. Okay, so you're going to feel a little more percussing. Perfect. Now just bear with me, I'm just going to measure and make sure that the diameter is correct. And it's 4 centimeters, which is perfect, and about 4.5 over here. So we would say 3 to 5 is normal. So you're good there. Now I'm just going to percuss your chest area just to make sure that the lungs and everything sound normal. So let's just get you straight so you're symmetrical. Rock solid. Actually, I'm going to have you lay back for this one. Perfect. Okay. Go ahead and sit up. So now what I'm going to do is basically just listen to your lungs for any abnormalities or anything like that. I'm going to start on the back and then come to the front, okay? So the first thing I want you to do is I want you to say 99 and just keep saying it as I move up, and I'm just feeling to make sure that it feels the same.
Start now.
Yes.
99, 99, 99, 99.
Perfect. The vibrations are normal. And now I'm just going to listen to you. Take a deep breath. Deep breath. And more. And just kind of hold your arms out for me. I'm just going to feel through here. Good. Excellent. So you had no abnormal signs at all of your lungs. Everything seems symmetrical. Sounds were clear throughout. You had no crepitus, no abnormal vibrations. So your chest seems fine. Now we're going to check out your heart.
Okay.
So on this, we're just going to kind of look at it, feel it, inspect it, and listen. All right. So what I'm going to have you do is, first of all, everything seems fine. You don't have any heart problems, do you?
No.
Okay. So I'm going to measure, kind of like feel around and measure your heart, okay?
Okay.
So I'm just going to feel here. And if you have any pain, you can tell me. Okay. What I want you to do is look to your left, and I'm just going to feel for your heartbeat here and your pulse here. So just breathe normally. Perfect. Okay. You don't have any circulation problems, do you?
No.
Okay. I'm just checking your capillary refill to make sure that your oxygen is perfusing throughout your body. That looks great. Okay. So the next thing we're going to do is I'm going to listen to your heart. I'm going to palpate your heart. Basically, we just want to make sure that it's not enlarged. So you can go ahead and lay back. This is just a little percussion. And this is the most important part here because we want to make sure that this is the right size and your heart on percussion feels perfect. So go ahead and sit on up. Now I'm going to listen to your heart. What I want you to do is just kind of sit straight forward here, and I'm going to listen, not quite that much. I'm going to listen to all the areas, then I'm going to have you lay down and then lay on your side.
Is this good?
Just breathe normal. Perfect. Everything sounds great. I'm going to have you lay back. You're nice and warm, right?
Yes.
Okay. And we're just going to do this again. Just breathe normal. The next thing we're going to do is just have you lay on your left side. Sometimes you can hear different abnormalities a little bit better. So I'm going to have you slide towards me just a tiny bit here and just a little bit more. And we're just going to do the same thing. I'm going to have you just put your arm like that. Perfect. Okay, and go ahead and sit on up. Your heart sounds perfectly normal. Your heart rate is definitely nice and normal. No extra heart sounds. I didn't hear any murmurs. No swishing, which would be like mitral valve regurgitation or anything like that. Your jugular veins look great, so we're not having any blood flowing there. So everything checked out fine on this particular exam. But if you have any problems with your chest or lungs, obviously you would want to see a pulmonologist or a cardiologist. Do you have any questions?
No, thank you.
All right, thank you for coming in today.